So, Mark, I just want to start with some pretty shocking news that I saw online this morning about this 21-year-old man from Kent who snapped 4 front teeth biting into an apple. And this was because he has been drinking quite a lot of energy drinks. I think he was drinking up to 6 a day. It was a horrendous photograph of this poor chap, which Christy couldn't even look at.
No, I couldn't even look at it.
But he said he was using the drinks to help keep him awake. And he says he did brush his teeth twice a day, but now he needs 24 fillings as well as some dentures. And he's really, really embarrassed about it. And he says he can't apply for jobs because he's worried people will just take one look at him and say no because of the state of his teeth. He's dropped out of college. And is this really the legacy of drinking these sort of things?
Yeah, I mean, energy drinks, the whole point is anything that's going to give you energy has got to be full of either caffeine or sugar, or caffeine and sugar. So they're usually acidic as well. So that amount of sugar and acid is going to do an awful lot of sort of damage to your teeth. And the problem is the guy's saying he can't sleep. If you think about it, if during the day you're constantly wired and buzzed up with that, then he's probably not going to be able to sleep at night anyway, because he's still sleeping, or he's still suffering the effects of the caffeine. So, I mean, the more coffee I have, like, the more jittery I'd get. You wouldn't want to see me after I'd had 4 cups of coffee. I was drilling your teeth.
So you mentioned caffeine and sugar.
Yeah.
Obviously, caffeine or coffee can sort of stain your teeth, but can it actually do damage to your teeth?
No, if you were on sort of just plain black coffee, I mean, I've got a cup in front of me, that's just black coffee. There's no sugar in that, so it's just coffee and water. So there's the whole point. If you take a small child who has a sugary drink, or if I gave somebody a glass of water and put some sugar into it, stirred it up and said, right, take that, what you've got there is the sugar and the plaque in their mouth. So you need those two things. In life they have the fire triangle. You know, you need oxygen, something combustible, and fire. So it's the same thing with teeth. You need your tooth, you need sugar, and you need the bugs. So the bugs eat the sugar, convert that to acid, and it's the acid that damages the teeth. So if you just have water or, say, plain coffee, because there's no sugar there, there's nothing for the bugs to use to turn into acid. Same thing if you've got no bugs. So if you've got perfectly clean teeth, you could theoretically, have a sugary drink. You could have a Mars bar. There's no bacteria in the mouth to turn the sugar into the acid. So that's where the effect comes. Now, obviously, if you're drinking energy drinks, most energy drinks that I know of come in a can. So it's very difficult to sort of screw the top back on. So if you've got something in a bottle, the worst thing is Coke, Pepsi, fizzy drinks in a bottle, because people tend to take a couple of swigs and then they put the lid back on, and then later on they take another couple of swigs. So like I was saying before, it's not so much the amount of sugar, it's the frequency of the sugar. But obviously if he's saying he's having 5 or 6 energy drinks a day, he's obviously supping from the can maybe for an hour, and then the next hour he opens another one up and he's supping that. So for probably the best part of 6 hours of the day, he's got sugar all over his teeth. So any bacteria that's there, even if he's brushed it first thing in the morning, grows up really, really quick because you're giving it loads and loads of sugar. And just like we kind of grow with sugar and get stimulated by caffeine, it's the same sort of thing with the bacteria. You give them sugar, they'll start to divide, they'll start to grow. I don't know what the effect of caffeine would be on bacteria, but for all I know, it might actually stimulate them as well. So you've got two things going against you.
It makes me talk like that.
And speaking of sugary drinks, one thing we're going to come to you with in a little bit is you did bring with you a list of sort of myths about dental care and dental hygiene. And one of them was to do with fruit juice and sugar.
Yes.
So first of all, tell us what the myth is and then...
So basically the question is fruit juice, you see, Beth doesn't know the answers to this, but is fruit juice better for your teeth than soda or fizzy drinks?
I would probably, I suppose because you hear the word fruit, so you think therefore it's healthier, but I'm guessing you're going to say no.
Yeah, it's not. You see, if you've got a diet drink, apart from the various sweeteners that they put into those, which, although don't really have any effect on your teeth, there's other issues that people talk about with sweeteners. But in fruit juice, you've got loads and loads of fructose. So the fructose, again, is a sugar that the bacteria can use to sort of damage your teeth. But also things like orange juice and freshly squeezed lemonade type things, grapefruit juice, it's all full of acid. So it's the acid that damages the teeth as well. And that softens the enamel. there's a graph of sort of tooth damage, and once the pH in your mouth gets below about 6, then the enamel part of the tooth, the harder part of the tooth, is actually damaged and softened. So what happens is you have a sugary drink, the bacteria convert the sugar to acid, and the pH in your mouth drops. The acid level, if you like, goes up, and the teeth are being damaged. The longer the teeth stay in that acid level, the more damage there is. So the quicker you can neutralise that acid, the safer your teeth are. But of course, with fruit juice, the acid level is kept low, so the damage is there. Or the acid level is high, the pH is low, so the damage is being done to your teeth.
So does that mean that if this chap who was having the energy drinks had substituted them for juice, it would be as bad, if not worse?
It would probably be as bad if he had a litre. You see, if you think about it, if he's had 6 energy drinks, that's probably 3 litres of energy drink a day. Now, that's a big thing of Coke, or think about it, three cartons of orange juice. So, I don't drink that much I don't drink that much water a day. I should do, but, I don't. And 3 big litres of orange juice is quite a lot. So that's going to cause quite a bit of damage.
Okay, is there any way then of neutralising that acid?
Yeah, I mean, you can rinse it out. Just plain water will help. Chewing sugar-free chewing gum. It's got to be sugar-free. And then things like cheese will neutralise acid quite quickly. So for kids' snacks and things, if the kids are going to have some fruit, have some cheese or have something afterwards that will neutralise it. They're sort of saying that vegetable sticks, carrot sticks, cucumber, that sort of thing, there isn't the acid in those, so they're probably better for kids' teeth than the fruit.
Just feels like maybe we need some sort of protective guard when we're eating or something. Is there anything like a little coat for my teeth?
No, the problem with that is, you see, you've got the little coat, nothing will ever fit snugly enough to the teeth to stop it. So when patients have gum shields in, Invisalign, tooth straightening trays, and even the problem with brackets and wires, because you've got these areas where stuff gets in and sticks and there's all this gungy stuff that's there, then I'm afraid it's right on top of the teeth and it's just doing the damage where it wants to do the damage. So yeah,
it's just a case of looking after them, Beth.
I'm afraid it is. Little and often.
Regular trips to the dentist.
Yes.
Gentle brushing, but gentle but thorough brushing. See, that's what you want.
Tell us more about some of the dental myths then.
Some of the dental myths. Okay, well, if I kind of read from my crib sheet and my quick notes here. What should we go on? Okay, should you rinse your mouth after you've brushed your teeth?
I think I know the answer to this one because I think you've said it before, and I'm going to say no.
That's right. The idea is once you've brushed your teeth, all the fluoride that's in your toothpaste, you can spit it into the sink. If you really, really don't like the taste, you could either change the toothpaste, or what you can do is you can get your toothbrush, put your toothbrush under the tap, so you've got a little bit of water on your toothbrush, and kind of suck that water off and then spit that out. But the more toothpaste you've got kind of on your teeth, the more fluoride that stays there. You'll swallow some of it, but it's not a major issue. As long as you're not sort of eating the toothpaste, you'll be all right.
And we have talked about this before as well, but just remind people, so the likes of even, mouthwashes that say they have fluoride in them. Yeah,
there's probably more fluoride in your toothpaste than there is in the mouthwash. So if you then rinse with a mouthwash, you'll wash the fluoride away. Now, that's not to say if you've got gum issues and there's gingivitis or periodontitis, which is sort of gum problems or bone problems. With those ones, then a dentist may say to you, right, well, I want you to rinse with this toothpaste. I want you to use this toothpaste and then rinse with this mouthwash, because you might be washing the fluoride away, but you then want the protection on the gums, not the teeth. So that's why it's that way.
Okay. And also,
go on.
You shouldn't wet the toothbrush before you put the toothpaste on it?
You don't have to. The reason that everyone sort of wets their toothbrush before they put the toothpaste on is not because we know why or how. It's probably because your mum and dad said rinse it under the tap and then put the thing on. Because years ago, and they probably don't know why they do it either, toothbrushes were made from a sort of coarse bristle, and it was really hard, and you had to soften it and soak it for a little bit before it went softer. So if you brush your teeth straight away, you might damage the teeth, but you'd certainly cut your gums. So they used to run them under the tap, soften them out a little bit, and then use the toothpaste that way.
Okay.
You're not happy about this, are you?
No, I'm all right. I'm just like, Yeah.
I can talk to you with my eyes closed if you want. I can do that, so that way you can.
I think I do always feel really
You do. No,
self-conscious.
you're always caught like
I know.
that. I've never seen because you've got great teeth, but you kind of do that.
There you go. You've got great teeth. She's going to take that one. So speaking of cutting your gums, then there was one about bleeding gums that you had.
There was
as
about
well.
bleeding gums, and it was should you brush your gums if they bleed?
I want to say no because it feels like that would
Yeah.
hurt.
Should you brush your gums anyway?
Should you brush your gums anyway? Yes, you should. But when a dentist says to you, brush your gums as well as your teeth, what we don't mean is as high up into your cheeks as you can possibly get. The best way to describe it is you want to brush the interface between your gum and your tooth. So if I can sort of draw or sort of demonstrate it, if this hand is a tooth and this hand is your gum, there's like the gutter on the side of the road. You've got the pavement and you've got the gutter. Okay, it's not a surprise or it's not a coincidence that road sweepers have a rotating brush that sweeps in, and dentists have rotating brushes, and lots of automatic toothbrushes, mechanical toothbrushes are rotating because it sweeps into the sort of the gutter, the margin in between the gum and the tooth, and lifts all the bits out. So if your gums are bleeding, what you want to do is you want to brush them, like I was saying before, be gentle but be thorough. So you're not trying to scrub like crazy, and you want to kind of look at where it's bleeding and very gently just kind of work in that area. If it's a manual toothbrush, then you can just kind of do almost like a round sweeping motion. If it's an electric toothbrush or a mechanical toothbrush, just gently hold it against the tooth and just move the handle of the toothbrush so that you're moving the head of the toothbrush ever so slightly. So it's just moving round more on the tooth, but the bristles will then get onto the gum as well and lift all the plaque away from the gums.
And it doesn't flossing help with bleeding gums?
Flossing will help with bleeding gums because it helps to your gums themselves. You can move floss a good sort of 2 millimeters under the gum. People always the one thing you mustn't do with floss is think of it. You're not a Canadian lumberjack trying to chop down a tree, all right? So you don't want 2 foot of floss doing this, going backwards and forwards, all right? When you buy the little flossing holders, there's about 1 inch of floss, okay? You can tell if someone cut my hands off, I'd be no good as a dentist or I couldn't talk either. So they have 1 inch of floss, and the reason for that is they're quite small, they fit in, and that inch of floss is all you need to clean in between your teeth. Not a big piece. You might take off a big piece and then wrap it around your fingers, but then you work away so you're using a clean bit at each tooth. With the little flossing sticks, run them under the tap, get them clean, and then work your way along that way. But the floss, again, you put the floss down in between the gum and the tooth, ever so slightly, and then just lift it up and out, or if it's the top teeth, you're lifting it down, if it's the bottom teeth, you're lifting it up. If you push it in and it hurts, you've pushed too far.
Okay.